We see our dogs do the strangest things, and it is almost impossible not to project our own complex human emotions onto those quirks. But treating them like furry little humans creates a severe blind spot. It actively masks the biological and medical signals they are trying to send us. To understand what they are experiencing, we have to move past these emotional myths and analyze the biological drivers behind their behavior. Projecting human thoughts onto a dog leaves owners completely unaware when a harmless-looking habit is actually a life-threatening medical emergency. Take the classic head tilt. It is universally read as a sign of confusion, curiosity, or active listening. In reality, a dog's ear flaps, the pinnae, can physically block sound waves. By tilting their head, they are manually adjusting those flaps to triangulate the exact distance and direction of a noise. It also solves a physical vision problem. A dog's long snout completely obstructs the lower half of their field of view. This animated wireframe shows exactly what a dog sees. When they tilt their head, it rotates their snout out of the way, clearing their line of sight so they can accurately read human facial expressions. There is a scenario where this behavior demands immediate attention, a persistent tilt that happens without any sound to trigger it. A head stuck at an angle points to severe inner ear infections, or a condition called vestibular disease, which disrupts the delicate balance centers in their brain. Whether the dog is optimizing their senses or suffering from a neurological disruption, the head tilt remains a physical response that owners often unintentionally reinforce with their own positive attention. We also tend to view excessive licking or kisses as pure, undeniable affection. For an adult dog, obsessive licking is frequently a physical response to gastrointestinal nausea or a self-soothing mechanism triggered by high anxiety. If you notice your dog obsessively licking strange surfaces like floors or walls, they are likely suffering from a medical condition called Pica. This flowchart maps out the cycle of Pica. A severe underlying nutritional deficiency triggers cravings for non-food items, driving the dog to ingest dangerous materials that cause gastrointestinal blockages. When those licks land on your face, it presents an immediate human risk. Studies show these kisses actively transfer gum disease-causing bacteria directly from the canine microbiome to yours. Dismissing this behavior as affection masks the bacteria being shared and allows the dog's underlying nutritional deficiency to go unaddressed. Then there is the destroyed backyard. Many owners assume a dog digging up the lawn is acting out of anger or seeking revenge. Dogs lack the mental capacity for spite. Digging is a behavioral trait rooted in evolutionary survival. Northern breeds dig to reach cool earth for thermal survival. Terriers dig because their high-frequency hearing allows them to detect the exact location of rodents scurrying underground. When destructive digging occurs outside of these specific breed traits, it is a clear indicator of severe psychological distress. A dog left alone with insufficient stimulation will channel that pent-up energy into the soil. It is a physical manifestation of separation anxiety or a chronically boring environment. A destroyed yard serves as a visible indicator of a dog's internal stress and unmet psychological needs. The core issue behind all of these misunderstandings is biological. A dog's physiological wiring guarantees their output behaviors will never align with human logic. The ultimate example of this biological divergence sits right at the front of their face, the canine nasal cavity. This cross-section diagram shows a dog's snout. Inhaled air splits into two distinct pathways. One pathway is dedicated exclusively to respiration. The upper pathway functions entirely for olfaction, trapping scent particles. These separate systems let dogs continuously process chemical data without pausing to breathe. This sensory divergence extends to their palate too. Dogs lack sweet taste receptors entirely, which shapes how they perceive rewards and navigate their environment in a way we cannot experience. To care for these animals, we have to stop acting like human pet owners and start acting like scientific canine translators. Leaving our human-centric perspective behind is the only way to understand the reality they actually live in, and the only way to truly protect their health.